Hello, everyone, and thanks for joining me today. We're going to talk about something very important, dementia. It's a word that can sometimes feel scary, but we're here to break it down and make it easier to understand. So, what exactly is dementia? Simply put, dementia is like an umbrella term. It describes a group of symptoms that affect the brain, especially memory, thinking, and how we make decisions. It's important to remember that dementia itself isn't a specific disease, but a collection of symptoms caused by different conditions. Now, you might be wondering, who can get dementia? While it's true that dementia is more common as people get older, it's not a normal part of aging. Anyone can be affected, though certain factors can increase the risk, like family history or medical conditions like stroke. Let's talk about what causes those dementia symptoms. One of the most common culprits is Alzheimer's disease, which damages brain cells and affects communication within the brain. Another common cause is vascular dementia, often linked to problems with blood flow to the brain, like after a stroke. But remember, it's not just Alzheimer's or strokes. Other conditions, like Parkinson's disease or Huntington's disease, can also lead to dementia symptoms. The important thing is to figure out what's causing the changes in each person so doctors can create the best plan possible. Early on, dementia might show up as simple forgetfulness, like misplacing keys or forgetting appointments. But as time goes on, the symptoms can become more noticeable and impact daily life. Someone might struggle to follow conversations, have trouble finding the right words, or experience changes in their personality or mood. It's important to pay attention to these changes and talk to a doctor if you notice anything concerning in yourself or a loved one. Early diagnosis is key because it allows for earlier treatment and support, which can make a big difference in managing the condition. While there's no one-size-fits-all cure for dementia, there are treatments and strategies that can help manage symptoms and improve quality of life. Medications can sometimes help with memory and thinking problems, and therapies like occupational therapy can provide tools and techniques to cope with daily challenges. But it's not just about medical care. Creating a supportive and understanding environment for someone living with dementia is crucial. This could mean making adjustments at home, engaging in meaningful activities, and offering patience and reassurance. Remember, you're not alone in this journey. There are incredible resources available for both individuals with dementia and their families. Organizations like the Alzheimer's Association offer a wealth of information, support groups, and even respite care to give caregivers a much-needed break. Living with dementia can be challenging, but with the right support, understanding, and a little bit of hope, it's possible to navigate this journey with grace and resilience. Thank you for joining me today, and please remember, there is always hope, and help is always available.